In our last video, we asked a difficult question. Did Patrick Clancy know enough about Lindsay's deteriorating condition to prevent what happened to their 3 children? But after going deeper into the testimony, that question opened the door to something much bigger. Because when you reconstruct this case piece by piece, some of the evidence doesn't fit neatly into one explanation. So this time, we're not accusing anyone. We're going to reconstruct the evidence and test every reasonable hypothesis. Months before the tragedy, Lindsay was struggling. Severe insomnia, anxiety, suicidal thoughts, intrusive thoughts involving her children, different doctors, different medications, and repeated attempts to get help. Her treatment records have now become one of the biggest battlegrounds at trial. One provider testified she had no major concerns, but another provider was documenting increasingly serious symptoms, and testimony revealed that some of Lindsay's providers were not fully reviewing each other's records. That gives us our first hypothesis. What if this tragedy was primarily the result of a psychiatric collapse that the medical system failed to recognize? But prosecutors see something very different. They point to what happened on January 24th. Lindsay checked the restaurant. There was communication about CVS. Patrick left the house around 5:15, and prosecutors argue Lindsay deliberately created a window in which she would be alone with the children. That gives us hypothesis 2. What if Lindsay was thinking clearly enough to deliberately plan what happened? But then we reached the digital evidence. Investigators found a disturbing search. Can you treat a sociopath? At first, that sounds extremely important, but there's a problem. A search tells us what was typed. It does not automatically tell us who Lindsay was thinking about. And her phone contained something else investigators also had to confront: searches about psychosis, hallucinations, schizophrenia, suicide, and psychiatric symptoms. So which search history represents her actual state of mind? What kind of husband were you? And that creates hypothesis 3. Could behavior that looks calculated from the outside have been happening at the same time as a severe psychiatric breakdown? Now we get to the night itself. Patrick returned home shortly after 6. He testified that the house was unusually quiet. Upstairs, he found an open window and what he described as blood. Then he went outside and found Lindsay badly injured. Patrick testified that Lindsay had what he described as deep cuts on her wrists and a red line across her neck. He says Lindsay told him, "I tried to kill myself." And when he asked where the children were, Patrick says she told him they were in the basement. That statement is extremely important. But this is where we have to separate what Patrick remembers from what can be independently reconstructed. Lindsay was severely injured. Accounts from the 911 call describe her condition as impaired, and Patrick was desperately trying to communicate with her. So the question isn't simply whether Patrick lied. There is no evidence establishing that. The question is, how much was Lindsay actually able to communicate, and which parts of that conversation are independently captured by the 911 recording? Then there are her injuries. Patrick described deep wrist wounds and a line across Lindsay's neck. But first responder testimony reportedly described a different clinical picture, including an absence of significant active bleeding from those wounds when they treated her. That doesn't prove somebody else injured Lindsay. It doesn't even prove Patrick's description was wrong. A terrified husband seeing his wife after a catastrophic fall could perceive the scene very differently from trained medical personnel arriving minutes later. But it creates an unanswered forensic question. Exactly when and how were each of Lindsay's injuries produced? Which brings us to hypothesis 4. The commonly understood reconstruction is that Lindsay killed the children, injured herself, and jumped from the window before Patrick returned. But do the physical evidence, medical observations, and 911 timeline establish every part of that sequence down to the minute? Or is there still a small window we haven't completely reconstructed? And then comes the most controversial hypothesis. Could something have happened after Patrick returned? Maybe, allegedly. Patrick attacked Lindsay, so that theory cannot be presented as fact. But if we're reconstructing this case properly, we should still determine exactly how much time passed between Patrick arriving, finding Lindsay, calling 911, entering the house, locating the children, and first responders reaching Lindsay. Because if the 911 recording accounts for Patrick's movements continuously, that evidence could eliminate certain hypotheses entirely. And that's what an investigation is supposed to do. If the timeline, Lindsay's injuries, Patrick's account, and her mental health history don't fit one explanation, which hypothesis survives? Psychiatric collapse, deliberate planning, Patrick's reconstructed memory? Or are we still missing a critical piece of that night? Because there's another possibility. One that could change how we understand this entire case. Part 2 is coming.